Platelet-rich plasma, or PRP, is being recommended by more and more veterinarians. Sometimes it's because surgery is not an option, either due to cost or general anesthesia, or simply because they believe it is the best treatment option available. Either way, if your vet has recommended PRP for your pet and you want more information, you've come to the right place. A question people frequently have but rarely ask is, why does my vet recommend PRP? Well, the answer is there's many benefits to platelet-rich plasma. The first is that it's autologous, meaning everything that comes from the patient gets reintroduced to the same patient. There's nothing external, exogenous, so that means it's very safe, and we have lots of safety studies published. The second is that when we think of other treatments, such as anti-inflammatories or corticosteroids, they modify the symptoms. They don't do anything for the underlying disease process, whereas PRP has been shown to be disease modifying, so it actually changes underlying condition. And this is one of the reasons why PRP can have such long lasting effects, in some cases out even years. Let's begin by talking about the process. PRP is typically an outpatient procedure. What this means is that your pet usually doesn't have to spend the night at the hospital. Your veterinarian is going to begin by removing a small sample of blood and then centrifuging it. What centrifugation allows us to do is to separate the blood into its constituent components, one of which happens to be platelet-rich plasma. So using a proprietary device, the veterinarian will remove a sample of the PRP and then reintroduce it back into the patient. This is a pretty straightforward procedure, and it can be done in as little as 30 minutes. Some patients might be a little sore for a couple days after PRP. These can usually be treated with just anti-inflammatories. If you're concerned about the level of pain, be sure to contact your doctor. Improvement will depend on what type of condition you're treating. Some patients will show improvement within the first few days. More commonly, it's a little slower onset, but by 1 month, you should definitely see improvement for almost every type of condition. This brings up the next question: how long does PRP therapy last? Well, it depends. First of all, body condition. If you have a pet that's rather malnourished or one that's a little too chonky, we don't expect them to respond as well as a pet that was in good body condition. Same goes for other health concerns. For example, a dog with diabetes that isn't well regulated, we're going to reduce our expectations. And lastly, is the condition being treated? So the most common thing being treated is going to be arthritis. And for most cats and dogs, we're seeing 9 to 18 months. For tendons and ligaments, however, even though they might be slower to respond to treatment, if they respond, they usually last many years. Bottom line, every patient is different, so be sure to talk with your veterinarian. Thank you for your time. If you have any more questions or concerns, please be sure to reach out to your veterinarian.